Hi everybody, my name's Emily and I work at the Trauma Survivor Network, which is inside Inova Fairfax Hospital. And we provide support to patients that are currently in the hospital for trauma reasons or patients who've been released from the hospital and are now coming back for emotional support and groups and stuff like that. So I'm going to talk about a client named Dawn who comes to two of my support groups, and so I've gotten to know her pretty well, and I'm kind of having the same issue with her. I guess the question that I want to ask is the same from the two different groups that I have going with her. Okay, so Dawn is a married woman, no children. She is about 60 years old, and by trade, she's an industrial psychologist, but due to her trauma, she has a traumatic brain injury. She is no longer able to work currently, although her goal is to get back to that job eventually. So a little bit about her trauma. She was at work and she took a walk. She wanted to take a walk to go outside, and so she came downstairs into the parking garage, and she's a pretty tall woman, and it was dark in the parking garage, and she ended up walking directly into a steel beam in the parking garage, and they have cameras of it because it was in the employee garage, so she knows that she hit the beam and she passed out, and she was unconscious for 5 to 10 minutes, and she tried to get up once and hit her head again, and so that's kind of compounded her TBI. And anyway, so that's what her initial trauma is that she came in for, and it's taken her a really long time. I would say maybe a year. This trauma happened 2 years ago, and it's taken her about a year to really realize that this is a traumatic brain injury and that she has a lot of deficits due to her injury. So I guess a little bit more about her functioning. She has past mental health issues with major depressive disorder and anxiety, and she sees a psychiatrist regularly, both before the trauma and now since the trauma, and she is on medication for both of those. And her physical functioning, she was completely physically functioning before the traumatic brain injury, and since her accident, her biggest issue is initiative. So she really lacks the connections in her brain. She might see light bulbs out. I need to go fix that in her house, but she doesn't have the mental capacity quite yet to follow through to actually go get a light bulb and pull it out and replace the one. So that's her biggest cognitive deficit that she struggles with and talks about a lot. But she also has some struggles with aphasia, with struggling with her speech. She has cognitive delays. She has lots of issues with memory, and what else? Those are the main things related to her traumatic brain injury. But because of her field, industrial psychology, she can't return to work because of her lack of organization. She did initially try to return to work, and she stayed actually for 6 months at her job because she didn't really get a clear diagnosis from a lot of doctors. She didn't know what was wrong with her, so she kept going to work. And she had a very high-powered international level job that was very demanding, and sometimes she would get to work and then see a pile of stuff to do on her desk, but she couldn't take the initiative to do it, or she didn't know how it got there. Stuff like that. So she eventually, unfortunately, got kind of manipulated at her workplace to leave. They kept increasing the tasks in order to get her to quit on her own because she couldn't handle it. So her career is huge to her, and this is something that we focus on a lot in the group therapies that I have with her. It seems to be that there are two different grieving processes or losses that she's going through. One is the traumatic brain injury and just her daily functioning that she's lost, and the other is the loss of this job connection, because that really formed a lot of her identity for most of her life. And so she's really struggling a lot with that. Emotionally, she can present as being kind of on guard a little bit at first, and she kind of does that from the get-go at every group that she comes to. But it doesn't take her very long for her to something to trigger in her that is talked about during the group that she gets really emotional. We've progressed and worked on it more, but I would say when she first came, she would cry 75% of the group time, so an hour and a half, 2 hours. And she's progressed now that she might cry like 5 or 10 minutes of the group. So she's doing a lot better with that, and I think that the groups have definitely helped her. She talks a lot about how much they have, but I think she also has a really great support system. She has a husband who's been very supportive, and a sister as well. But unfortunately, a lot of her support system as well was at work, and so she's really lost a lot of that connection. And another TBI deficit that she has is talking on the phone. She can talk much better in person, but she really struggles with the phone. There's, I'm not a doctor, so I don't understand it, but there's something in the brain that doesn't connect with the phone piece. I don't know if it has something to do with her not being able to see the facial expressions. But so she's been unable to stay connected with anyone at work. Plus she feels very betrayed. So the two groups that I am working in with her, one is an art therapy group, and that seems to be a really great avenue for her, although she is typically more emotional in that one. And that one is also, it just happens that the group is comprised all of women, and the women are really, they're very empathetic and very supportive, and they occasionally hang out outside of group as well. So there's a lot of camaraderie, and that's been really, really powerful for her as well. And the other group that I am helping with is called Next Steps, and that's kind of working on what is my next step in life now that I have this trauma. Most people are unable to return to work after their trauma, just like Dawn is not able to. And so that's a big thing that's talked about, is who am I now? And so she ends up talking a lot about how she was an industrial psychologist for 30 years, and it's all she knows, it's her identity, and now she doesn't know what she's doing with her life. And so those are the two contexts that I see her a lot in. So I see her every week, and between those two groups. And I am bringing her up mainly because she came in last week and told us all that she received some results back from an MRI. It's common with TBI to, once it's diagnosed, to down the road try and get updates, CT scans or MRIs of the brain to see is there any progression with my brain injury, are things getting any better. It sometimes helps patients a lot with, quite frankly, with insurance or getting benefits, getting Social Security disability if they have some proof. So So she went to get an MRI related to her TBI, and unfortunately they found 2 large brain tumors. And obviously this has kind of compounded her her trauma issues, and her anxiety that she previously had dealt with is really come back full force. So the issue that I struggle with, because it is a group setting, is Dawn tends to kind of dominate the group. She tells really long stories, and tends to just share kind of a lot. She'll go like 10-minute stretches where she kind of takes over the group. And although I think a lot of it is valid because she is going through a lot right now, it can be really challenging to try and keep her focused. And I always want to respect and honor her traumatic brain issues and her cognitive deficits, because I just think that it's important to do that. But I also want obviously the other group members to have a chance to speak and make sure that they feel that they are an inclusive part of the group. So so that is my challenge that I wanted to ask everyone else, is kind of what next steps do you think that I can take in the group to try and make sure that I'm addressing her needs, and addressing, especially, you know, the brain tumor issue is huge right now, and I understand that, and I think it's important to address all of that, but I want to still respect everyone else's time and build camaraderie and support among the group. So I'm looking for any advice that anyone has, especially creative ones, because I feel like I've tried all the ones from the textbooks, and it kind of keeps still happening. And I guess the other thing to note about it is that she has really good insight and self-awareness that she does it. So we've talked about it a few times, and she kind of just gets in the moment and runs with it. So yeah, that's my case. That's Dawn, and I was just wondering if anyone has any thoughts. Thanks.